10 Low Glycemic Fruits for Diabetes, Diabetes Management with Fruit. People with diabetes should keep a few things in mind when dealing with their condition. First, it is important to regularly monitor blood sugar levels. This can be done with a simple fingertip test or a more sophisticated continuous glucometer. Secondly, people with diabetes should eat healthily and stay active. This means eating plenty of fruits, vegetables, and whole grains and avoiding processed foods and sugary drinks. Finally, people with diabetes should take their medications as prescribed and see their doctor regularly to stay on top of their condition. What is the glycemic index? The glycemic index is a value assigned to foods based on how quickly those foods raise blood sugar levels. Foods with a high glycemic index are digested and absorbed quickly and quickly raise blood sugar levels, while foods with a lower glycemic index are more likely to keep your blood sugar stable. There are many reasons why you might want to follow a low glycemic index diet. For starters, if you have diabetes, keep an eye out for spikes in your blood sugar. Eating foods with a low glycemic index can help you control your blood sugar. The glycemic index can be a useful tool for blood sugar control, especially for people with diabetes. All berries are good for people with diabetes because they contain less sugar and a lot of fiber than other fruits. Strawberries have a GI of 41 and contain more vitamin C than a whole orange. Oranges are known for their high vitamin C content, which contributes to a healthy immune system. Grapes are a low glycemic option, and because of the large amount of skin they contain, they are high in fiber. Grapefruits are a perfect on-the-go snack. With high amounts of vitamin C and lots of healthy fiber, they help keep your body healthy and strong while fighting disease. Cherries are rich in potassium and packed with antioxidants, which will boost your immune system. Peaches are packed with vitamins C and A, iron, and potassium and have a GI of 42. Finally, if you have diabetes, it's not the end of life. You need to face this health challenge. It's important to monitor your blood sugar and take steps to keep it under control. High blood sugar can damage your blood vessels, nerves, etc.